All right, welcome. Today we're going to go over the structures of the heart itself, and just the blood flow through it. What you'll need is a blue colored pencil or pen and a red colored, okay? So we're going to start out with the frontal plane cut, and the ventral view of the heart, okay? Because I think it's easier to start out with this, and then we'll go to the view that has all the muscle on it, just kind of that top ventral view that's not cut. Okay, so we're gonna be color coding this a little bit. All right. First thing you need to know is that arteries take blood away from the heart, regardless of whether it's oxygenated blood or not. Okay, so arteries. Remember, art is from the heart, so arteries go away from the heart, right? Take blood. Oh, need to make sure I leave room. Away from the heart. Okay, veins, they're always taking blood towards the heart. Okay, arteries are right after the heart. They have the highest blood pressure in them, so they're different structure. They need to be more muscular. Remember, they have more smooth muscle, and they're just a little thicker there. And the veins are just less smooth muscle because they don't have as much of the blood pressure behind them. So they're a different shape, different structure. So they take blood to the heart, and veins kind of make an arrow, right? The V could be like an arrow. So you can think of it as going towards the heart. All right. So however you like to think about it. We're color coding today, and what we're going to do is oxygenated blood is going to be what color? Yeah, let's make that red. There we go. Oxygenated blood. All right. So make it red if it's oxygenated, and then let's see, deoxygenated blood is going to be blue. Okay? Right? You guessed it. Okay, there we go. All right, we're going to try to trace the pathway of blood as it comes to the heart, and then away from the heart to the lungs, back to the heart, and then to the rest of the body. Okay. This is how it's going to go. Here's your roadmap. So everything goes right to the heart. Haha. Just like right heart. I said it, now I'm writing it. Just like, some people take a lot of things to heart. You know what I'm saying? Well, on the right side of the heart is where the blood first comes. So from the body, so I probably should say body. Then it goes to the right side of the heart, and then it goes to the lungs, picking up oxygen. You want to do that right away. And then it goes back to the heart, and it's going to be back to the left side, though, because the blood is going to leave the heart on the left side. The blood has left the heart, right? Haha. Okay, and then it's going to go to the body. I guess we could do this and be like, oh, full circle. And that's how the flow goes. Okie doke. So let's look at what happens as the blood's getting into the heart. All right. So like I may have said before, I don't know if you remember, the blood collects from the lower extremities into the inferior vena cava. All right. So you have the inferior. And vena cava is just a very large vein. Literally means vein cave. It's so big, it's like a cave. All right, so it's different than just a vein. Okay, it's unoxygenated. It goes in here, but also blood from the upper extremities collect into the superior vena cava. And the superior and the inferior vena cava, they don't join. They just both dump into what we call the right atrium. The right side of the heart, first the right atrium. Now, when you have a house, and a lot of times, big like mansion houses, they might have like a little porch in the front, and it's enclosed, and they might call that an atrium. So it's like the welcoming part of the house, the first part of the house, maybe, or it could be high ceilinged or something. So that's your right atrium. blood comes in from the superior and inferior vena cava. You have to be careful when you're dissecting, because if you cut off the superior and inferior vena cava, you accidentally cut out the right atrium oftentimes, okay? So that's hard to deal with. So it's going to go past a valve to kind of try to make sure the blood doesn't go back. And the next structure that the blood's going to enter is the left, or the right ventricle, sorry. Where's our place to label that? Oh, I got the wrong thing. Let's label it here. Yeah. Okay. This right ventricle. And, you know, when you breathe, they call it ventilation. So I guess if it's venting out, it's leaving the heart. So blood always leaves the heart through a ventricle. Okay? So, and also the blood, it turns a corner, and maybe it makes a V. Haha. So maybe remember that is also ventricle. Okay? Also, A comes first in the alphabet, atrium, and then ventricle comes next. Okay, so atrium to ventricle. Ventricle, remember this is all muscle, this is all heart muscle, right? Okay, so myocardial muscle, right? So it's all going to contract. It's going to contract atrium to ventricle, both atriums, and then both ventricles, and the blood's going to go where it needs to go. But it goes past this valve, and let's call this valve the AV valve, and it's on the right side. So we're going to call it the right AV valve, and literally AV just stands for atrioventricular. Okay, so maybe we can write that here. If you left space here, AV equals atrioventricular, because yeah, it's between those two structures. Valves can be named for the structures that it's in between, or they're at least named for the structures they protect. Like they'll protect blood flow from flowing back from the ventricle into the atrium. Okay, so this is interesting here. This valve, you know, it's hard to see because it's not three-dimensional, but there's some tendons attached here. Those are your heartstrings. You know, if somebody's tugging on your heartstrings, well, there they are. They keep that valve from flooping back when the ventricles contract, because you want to keep the blood in the ventricle and going towards that direction, towards the lungs, towards the pulmonary artery. So these heartstrings are going to keep that valve from inverting or prolapsing, and they're literally, we call them tendon cords in Latin, I guess, maybe Chordae Tendoneae, because they actually are attached to, oh boy, barely squeeze that in. They are attached to muscles, and those muscles are going to keep the tendon from stretching and prolapsing. Even though the heart might change conformation a little bit, you know, as the heart beats, these muscles are still gonna pull back, and even though the ventricle kind of squeezes and as it's contracting. Okay, so it keeps blood from flowing that way through the AV valve. Okay, so we're gonna let's see. We need to write that somewhere, that the Chordae Tendoneae does that. I didn't really leave space. Okay. Yeah, I guess I could write it right here. Okay, so Chordae Tendoneae keeps AV valve, both of them, it's on both sides, keep the AV valves from inverting when ventricles contract. Okay, didn't plan this out super well. That's okay. So that's what your Chordae Tendoneae is doing. Uh-oh. I may not be able to talk. Okay, we'll see. So blood's going to flow to the pulmonary trunk and to the pulmonary arteries, to the lungs, and hopefully we're gonna protect it by another valve. And so we call it the pulmonary trunk because it's like the really widening of these vessels. Like that's the widest part, and then it goes into the left and the right pulmonary arteries. Did we determine which was the left and the right of the patient? Maybe you want to do that just to keep things straight. Okay, left and right. Okay, good. So this valve is a little bit different than the AV valve. It actually sort of covers more area And you look on it, and it's got these sort of half discs, partial discs, and it's kind of moon shaped, crescent shaped there. So we call them, because they're sort of partially crescent shaped, pulmonary, because it's going to protect the lungs, semilunar valve. So semi-moon shaped valve is going to protect the lungs and that unoxygenated blood as it goes into the left and right pulmonary arteries. Remember, even though it's unoxygenated blood, it's leaving the heart. Art is from the heart. So we're going to label these pulmonary arteries. That one was the left pulmonary artery. Okay, so I guess we could just say, yeah. And then right pulmonary artery. I just take an R and circle it for right and left pulmonary artery. Do not leave space. Okay, then it's going to go to the lungs. The left goes to the left. Yeah, just say lungs. And then it's going to come and collect into pulmonary veins, even though it's oxygenated. Yay. So we can draw a little blue arrow of unoxygenated, draws the lungs, leaving the lungs would be a red arrow. And blood's going to collect and go directly into the left atrium. Okay? So put pulmonary vein. That's the left. Actually, pulmonary veins, it looks like. They haven't quite joined each other yet, but that's fine. Oh, and I didn't leave a spot on the other side for the pulmonary veins. Okay, just remember, it goes to the lungs. And then it goes back here. Okay. Maybe, hey, fun. Have fun. Just label it anyways, just for funsies, huh? Pulmonary. Goodness. Pulmonary vein. Okay. Sweet. Now it's going to collect into another atrium, but that's going to be on the left side. All right. This is the oxygenated blood collecting. And there we go. Welcome, welcome, welcome. But they collect in the left side, left atrium. Here we go. And it's going to go past the left AV valve. All right, just like we did before. And then the blood's going to go to the left ventricle. So here we go. Left atrium. Whoa. Okay, here's the left AV valve. Same as the right, or at least very similar. Here we go. And up here actually is, so we're going to, left ventricle. We need to label it, don't we? Here we go, here we go. It's going to go into another valve, another semilunar valve, okay? Because that's just the type looks like. Oh. By the way, after it goes past the heartstrings, the Chordae Tendoneae, and it goes past the muscles. Those muscles, here's a place to label them. They're papillary muscles. Okay, that also keep the left AV valve from prolapsing when the left ventricle contracts. Okay, cool. We're also going to label this aortic semilunar valve because it's a semilunar type. It's a little bit different. It doesn't have to worry about prolapsing as bad as these AV valves. You see the design on the AV valve. However, it's possible to do that, and if your valve gets damaged, you have to probably get it replaced because it's hard for that to heal. Now, the blood went sort of down, right atrium, right ventricle, into the front, and then the blood went to the pulmonary arteries through the back, to the back, and then collected in the back, and then the blood from the right or left atrium and left ventricle is going to kind of tuck under that created branch that goes into the pulmonary trunk. So we're under here. Do you kind of understand that? It's three-dimensional, but it's hard to see. And then we leave through the aorta to all the other arteries of the body. So the aorta is the big mama jamba. artery, so we give it its special name that goes to the rest of the body. And remember that the aorta has its own smooth muscles that also help contract. Okay, so some things to note on this picture. There's a septum. There's a between the left and the right ventricles, and we call that interventricular septum. Okay. And it's pretty strong, but something I want to call your attention to, and it doesn't really come out in this picture, but the left ventricle is very thick, super thick usually. If it's super thick, you might have some high blood pressure and your heart's having to work too hard. I was working too hard for whatever reason. But so yeah, thickening isn't super great. Even if you have a large heart, and large heart isn't super healthy. But just saying that it's going to be thicker than the right ventricle, because the left ventricle has to pump the blood to the rest of the body. So yeah, it's going to need to be stronger and thicker to be able to pump the blood all the way through all the arteries, arterioles, capillaries, veins, and collect it back into the heart so that I'll have enough blood to pump again. Okay? So you have to keep that blood pressure up. Here's another thing that I haven't really mentioned, but all the atrium, ventricle, and the valves are all lined with that endocardium. Okay? Which is type of epithelial tissue or endothelial tissue. That's that smooth, simple squamous. Okay, so it's very thin and smooth, and it keeps from clotting, unintentional clotting from occurring. Also, it signals if it thinks it's bleeding and it's got inflammation, and it'll signal blood clot, or if it's damaged, it'll signal, hey, we're damaged here. Unfortunately, they're finding out that if you're having some inflammation, your body might think that it's bleeding, and it's actually not. Okay, so you want to keep that endocardial lining healthy, and it lines everything, it covers everything, and it's a continuous lining throughout your entire circulatory system, okay, including the heart, and then the pulmonary arteries and arterioles and the pulmonary capillaries and stuff like that. Okay, so this is good. Let's look at the other picture and kind of review us on these structures of the heart muscle. Oh, one thing to note too, that even if the heart's not receiving signals from the medulla to the heart can beat on its own, is what I'm trying to say. It's got little AV nodes, they call atrioventricular nodes, and they are strategically placed so that it starts a signal in the atrium, and then it'll propagate, because remember the cardiac muscle has intercalated discs which allow a nerve signal to travel down the muscle cells, so that if one part contracts, the next part is going to contract, and then the next one in succession, because you want to have that squeezing of atrium first, then ventricle. You don't want the whole heart, atrium and ventricle, to be beating, otherwise they're not, it's not allowing the ventricle to fill, and the heart's working against itself, and that might be called like fibrillation, where the heart's not actually allowing the structures to fill with blood and not beating in succession, both atrium, both ventricles. Okay, so we were trying to squeeze blood out of the heart into the lungs and back to the heart and back to the rest of the body. All right, so let's flip this over. It's still the ventral view. It just has all of the cardiac tissue. And one difference that you're going to notice here is that the heart itself has its own blood vessels. Okay, so remember a coronary cut? That's kind of like a frontal cut, and it makes a front and a back. Coronary, like crown, it's kind of like on top of, like if you go to a queen's coronary ceremony, that's when she's going to get crowned. So these are coronary arteries and veins. Ran out of space, but okay. Other than that, the structures are pretty much the same. We just left some of the frills on there of the pulmonary arteries and veins. Okay, so let's start at the beginning. Remember the beginning? become blood coming from the body, and it's unoxygenated and goes into the where? Right atrium. And what do we call the vessel that it travels with? Or travels to or through? Yeah, inferior of the body. Yep, inferior vena cava, vein cave. Okay. Then the blood also is coming from the superior vena cava too. Okay, superior parts of the body into that right atrium as well. So independently, superior vena cava. Very good. Then we got the patient's right and left. So maybe you want to try to label some of these structures based off of what we discussed, and do it on your own, and then watch this video and then be like, oh, test yourself. Okay, that might be fun. Then the blood is going to go to the right ventricle. This is supposed to be pointing, to this right ventricle. It's going to go past the AV valve, right? And make a V turn, all right? And then it's kind of hard to see because it's covered up, but that's your pulmonary trunk. Kind of look for the trunk with the branches, the T-shaped, okay? And it widens wider. Yeah, maybe less pressure. So we're going to call that the right ventricle. Going to vent out the blood to the lungs through the pulmonary trunk. But in this picture, we don't have a place to label the pulmonary trunk. We just have the pulmonary arteries. Blam. There they are. There's a left pulmonary artery and a right pulmonary artery. Can you label those? If you want to. Going to the left side of the body. Right pulmonary artery going to the right side of the body. And then the left lungs, left pulmonary artery is going to the left lungs, right pulmonary artery is going to the right lungs. Okay, always go to the right lungs. Okay, so I guess we could say, yay, goes to the lungs. And it's going to be picking up some oxygen and hopefully getting rid of that CO2. Remember the CO2 is dissolved in the blood too? So with oxygenated blood, so I'm going to use a little red pencil now. It's going to go back to the heart via the pulmonary, what? Yep, pulmonary arteries. What if I can abbreviate this? I didn't leave much space. Oh, sorry, pulmonary veins. I mean, thanks for correcting me. Remember, art is from the heart. The veins, yeah, they make a V and they come back to the heart. That was silly. Okay, pulmonary veins collected in here. Cool. It's oxygenated. Sweet. All right, so it's collecting where? It's kind of hard to see, but this is where it's collecting. It kind of goes in from the back into the, left atrium, past the left AV valve, and into the left ventricle. Okay, so let's label those. Left atrium, because the blood's about ready to leave the heart to go to the rest of the body, or leave the cardiopulmonary system, I guess you want to say. Maybe that makes more sense. All right, so it makes a little V turn, goes underneath the ventricle that was bringing blood to the pulmonary trunk and pulmonary arteries, and joins into this very, very large artery called, the aorta. And then that's going to go to the superior region. You have aortic branches, and you're going to go also to the inferior body. Also, the digestive system is going to go to all those lovely organs and the inferior of your body. And you have the hepatic portal system that the blood's going to go through and stuff like that. So yeah, that's kind of the deal there. So good job if you followed us thus far. Oh, here's that blood going to the inferior structures. Did we miss anything? I don't think so. We already wrote that arteries take blood away from the heart and veins take it to the heart. Coronary arteries and veins, just maybe you want to write a little note here. Maybe a little asterisk. Coronary arteries and veins. Well, arteries supply blood to the heart muscle itself, right? And so, yeah, the heart is a muscle, and it's going to need its own oxygen supply. And so it needs to make sure it has a good fresh supply that comes off the aorta, and you can see it feeds in there, and then the blood collects, and then there's a place that it feeds into, I believe, the right atrium to get its blood replenished, all blood oxygen replenished, we hope. So imagine this, if your coronary artery is thickened for whatever reason, maybe plaque, maybe it's endothelial lining, thought that it was bleeding, and you got blood, or you got blood plaque from whatever. Plaque's supposed to be actually a Band-Aid to stop the bleeding. And so actually plaque, it was meant to be a good thing, but we get a buildup of plaque if your body thinks that it's bleeding, maybe even if it's not. Maybe you're getting a lot of inflammation from your diet or lack of exercise or whatever. And if it's not the fat itself that's clogging your arteries, it's your body producing plaque, okay? Because there's something wrong and out of balance, and you need to fix that. Because if it clogs these pulmonary arteries, then the blood won't be able to flow to the heart muscle itself to give the heart muscle itself oxygen, which signals that it's going to that you're low oxygen, and then it's going to make the heart pump faster, because it's like, oh, we need to get more blood to the lungs to get more oxygen, which is going to make the heart muscle work harder, which is going to deplete the heart muscle of oxygen more, which is going to make the heart muscle try to contract more to get more oxygen to itself, which is going to make it work harder. And so you see that vicious cycle. It's actually positive feedback, even though it's a bad thing. Okay, it's positive feedback because it amplifies a heart attack, myocardial infarction, right? Okay, so these are the structures to know, and hopefully that you can study those and get those down, and what happens, where the blood goes and what the structures are, and keeping the left and the right of the patient straight too. All right, put your comments in there if you have some questions on that, and thank you very much for following this video. You guys are terrific. Have a great day.